you sweat buckets? We all sweat a little bit, but how much is excessive? Dr. Michael Rich is a dermatologist and this is his area of specialty. Michael, how much is too much and is it worse for men or women?
Both men and women sweat, but men do sweat a little bit more. And it's too much if it bothers the individual, really.
Sure.
In your case, when you go to the gym, you will sweat a lot. And I do advise my male patients to, when they walk around, to carry a little face washer and wipe the sweat off their face and so on. And then after the workout, go into the change room and wipe it all off, because there's odour and you get infections in the sweat glands, very much like acne. And that's a very common problem with, especially men who work out a lot.
So apart from the embarrassment, acne and odour, are the problems, are there any others that people...
Well, the embarrassment is a big factor and smelling is a big factor, but it's really affects professions. If someone has to write a lot, the hands do sweat a lot. When people eat and they start sweating in response. Embarrassment is the major one and smell is the major one. But infection is also very important.
What actually causes it? You've talked about exercise and stress and things like that, but what physiologically can cause excessive sweating?
Well, basically, it's just increased production of a salt water solution by the sweat glands, and exercise and certain things stimulated, but can be emotional upset, spicy food, can be anger, can be alcohol. Many factors will induce sweating, and of course illness as well. So if people have had a stroke or neurological problems, they'll get sweating. Then people who are diabetic, menopausal women, exercise, asthmatics, all these conditions will cause excess sweating.
So then what do we do about it? You talked about carrying a towel, but what are the other things we can do?
Well, beyond that, you can use preparations to diminish sweating. I don't think some of the lotions people buy in the pharmacy are of much benefit. They just hide the odour, they don't stop sweating.
So you're talking about just deodorants? You don't think they work?
I don't think they do very much, no.
Okay.
But it does remove the odour, and if someone does smell, not having the odour is important. Yeah. I've often advised my patients to use a salt crystal, and that can be bought in a health food shop or in some pharmacies, and the salt kills the bacteria and it's much safer, far less likely to cause allergies.
It's good to know.
How do you use it then, the salt crystal?
You just wet in the water and just wipe it on the area, and one rock crystal will last you 5 years, much cheaper.
Much cheaper than deodorant. Spend a fortune on the stuff.
What treatments are there then for people who do have excessive sweating?
Well, beyond being careful and wearing appropriate clothes and having common sense, take off your jacket before you're hot rather than wait to be hot, and wiping the sweat off. Beyond that, we can use aluminium chloride preparations, and the aluminium chloride really only works if it's applied for a prolonged period of time, when we're not sweating like overnight, armpits, palms and soles. Beyond that, botulinum toxin, Botox, is being used, especially in the armpits, and the government subsidises that in situations where aluminium chloride hasn't worked. And they have to see a dermatologist. Only dermatologists get to have the ability to prescribe it in that manner.
Can I just ask, on the aluminium chloride, which is that the main ingredient in the underarm deodorants? And if it is that there's been a lot of talk about that potentially causing cancer in people?
Yes, as I've indicated to a lot of my patients, I don't think it does. I think short-term application doesn't do it. There's no evidence and no literature to prove it. People have been worried about cancers, they've been worried about aluminium deposits in regards to dementia. But in real terms, I don't think that's been proven. But deodorants beyond that have basically fragrances in a solution to decrease the sweating. No, they don't have a great effect. But what can be used is anticholinergics, medications which reduce sweat gland production, and there are different types and different strengths, but they do have other side effects, such as drying the mouth, because they stop all secretions. So a lot of people find them uncomfortable.
How common is excessive sweating in society?
It's difficult to absolutely ascertain, but it's more common than people think. And in my practice, I'd see at least 20 patients a week with sweat problems, if not more.
And it's the embarrassment in most cases that drives them to see you, I'm sure.
Absolutely. I mean, I once had a general practitioner, a doctor, who had to change his shirt 4 times a day to cope. And he came in for those days, before botulinum toxin, for liposuction of the armpits, scraping out. It was really not liposuction, it's sweat gland suction. You suck out the sweat glands and scrape them out. That's about 80% effective rate. These days we tend to use the Botox more as a first line, but if that fails or inconvenient, then we can look at a measure such as that.
Thanks so much, Michael. Some fantastic tips there.